So the president said this week, well, actually the week before, that he wanted schools to open. Schools need to be open. Children need to be back at school. Those schools that are not going back and opening up, then they will be defunded, right? Of course, we know he also threatened them by the higher ed institutions and said that if they only have online classes, then the international students, their visas will be revoked. And of course, Harvard and MIT are suing, and I think the state of California is going to sue as well. So this whole notion of returning to school in the fall, the president's been beating that horse, and that's the bandwagon he's on. Others have joined him. CDC has even retreated and now singing a different tune about its plausibility. What are your thoughts? And we thank you for being so candid and so open, because now you've mentioned to us that the stool is a problem, the urine is a problem. So then that's another level of exposure that we hadn't even anticipated in our prior conversations. But what say you about this school opening that seems to be very imminent in some places?
Well, Dr. Thomas, I said this to your audience, when we talked, how many weeks ago was it? 14, 15 weeks ago?
16.
15, 16 weeks ago. There are three things that we need to stop this virus. 60 to 70% of the population has to be infected. And so in order for the virus to slow down, that translates, if we say 50 to 60%, I mean, you're a guy that knows numbers. We got 330 million people. So 60 to 70%, we need about 240, 250 million people to be infected. So where are we now? You had that at your in the beginning of your show about the number. We're at probably what, 5 million, 10, or more, 10 million. 5 million. Let's say we're off 10 times. Let's say we're not, supposedly we are not testing, right? So if we're not testing, and so we're testing at lower rates than we should. We're not testingly effective. We don't have a national plan. So let's say it's, instead of 5 million infected that we've reported, let's say it's 50 million that have been infected. Let's just say we underestimated by 10 times. We have to get to 250 million before we start seeing the herd effect.
What's the herd effect?
So the herd effect means that you've affected enough of the population so that your vectors go down, and so you don't have as many people. People are vectors, and you don't have as many vectors in order to infect, and so that the incidence begins to drop. We're talking about stopping the virus. All right. So we need about 60 to 70% of the population to be infected before we begin to see the virus begin to wane. Let's say we're at 50 million. We only have detected about a little over 5 million, but let's say we're at 50 million. We got to get to 250 million before it impacts the virus. So I just want to be clear. That's number one. Number two, the way to infect the virus is to have a safe and effective vaccine. So we don't have that. And then number three, another way to infect the virus is that we have a safe and effective drug therapy. And I guess we can also add in that because public health parameters like washing your hands, wearing gloves, social distancing, those things work, those policies work. And effective public health policy will provide us a way of limiting the virus, but not stopping it. You got to understand this, Dr. Thomas, that those policies like wearing a mask, washing hands, and social distancing 6 feet limits the virus. It contains the dog in the yard, but the dog is still there barking and biting. The only things that will really impact this virus will be getting a safe and effective vaccine or developing a safe and effective drug therapy. And at the moment, we all can answer that very clearly. We don't have that. So I'm gonna make a bold statement here to you. I'm gonna say something real bold here. Nothing has changed about this virus since we detected it in December 2019.
That's right.
All right, so I gave that preamble because Dr. Thomas, I gave that preamble because you asked me a real question. I mean, you keep it real on this show. You keep it super 100 on this show, and so I wanted to say, when we talk about school openings, the question is, now with that information, what will stop your kids from getting COVID-19 at school?
Mm-hmm.